All right. Hi, everyone. Good afternoon. It is good to see you all for this month's Kinetiq Health webinar, where Andrea and I will be talking about caring for the caregiver. So I am Jordan Shireen. I am a registered nurse and Kinetiq Health Program Manager. And Andrea?
Yeah, I'm Andrea Hickel. I'm a licensed clinical social worker and a Kinetiq Health Program Specialist.
Yeah, so as we get started here, just a couple webinar housekeeping items. All attendees are going to be in listen only mode for the duration of this webinar. However, for this webinar, if you've tuned in before, we're actually going to be doing more of a Q&A forum, if you will. So please utilize the chat box located in the right-hand side of your webinar screen. We'll be asking some questions, getting some participation, and one of our colleagues, Kayla, is here and monitoring that. So please utilize that as we go through. For audio access, attendees can use computer audio or call in using the phone option. And lastly, presentation slides and resources will be available at the end of our discussion today. And there are multiple resources that Andrea and I are going to discuss, and that URL will be available to you guys for each of those resources. So we're going to get started here as far as our agenda goes. So our agenda will be touching base on, you can read that there, but just to get started so you guys know what we are discussing today. So as far as my background, like I said, I'm Jordan Shireen. I am a registered nurse. I worked full-time as an inpatient nurse from 2017 to 2021. I actually worked in the ICU during 2020 and then also transitioned to surgical care. So I came to Apex Benefits back in 2021, but still practice over in a local hospital on a PRNs, which is as needed basis. But my experience is that I have taken care of a variety of patients with different physical needs and have assisted with families and friends who experience the toll that caregiving can take on them. And I personally have experienced and have seen how easy it is just to get caught up in taking care of somebody else and neglecting your own needs in the process. So we're going to discuss that today and how to help with that.
100%. And then I'm Andrea Hickel, as I mentioned, licensed clinical social worker. And so my role as a caregiver is kind of twofold. Before coming to Apex Benefits, I worked full-time at Riley Children's Hospital in the emergency room doing psychiatric assessments for children with chronic mental health conditions or conditions. And so I worked a lot with parents and caregivers on how to manage and care for children who have chronic mental health conditions or conditions such as autism that maybe take a little bit more of a physical toll as well. And then it was through my role at Riley that I got inspired to become a foster parent for older youth in 2020. And so throughout the past 3 years, I've cared for over 9 children in my home, and I adopted my daughter last year from foster care. And then I also have a 20-year-old former foster daughter who I currently support and care for as she is at college and on her own journey to become a social worker herself. So that's really kind of my role, both personally and professionally, with caregiving. So now that we've talked about our roles personally, what is a caregiver, right? That's what we're talking about today. And as you can see, it can come in a variety of different forms, but just generally speaking, a caregiver is an individual, so it could be a spouse, a partner, a family member, or a friend who is involved in assisting others in activities of daily living or medical tasks due to whatever certain circumstances they may be dealing with that require them to have a caretaker. And when looking at some statistics that we came across when doing a little bit of research with this topic, nearly 1/4 of adults report providing care or assistance to family or friends within the past 30 days, which I thought was a pretty large number of people that identify as a caretaker, but not necessarily surprising, And then when we look at that, for 1 out of 3 people that are in the role of caretaking, they say that that's equivalent to an unpaid part-time job. So there's a big responsibility there, a big time commitment there. Yeah. And you know, it's a very critical role, but it's something that can take some tolls on the individuals that are doing the caretaking.
Yeah, no, it's a very critical role. And just to bring it some clarification with that too, you know, a caregiver can be taking care of a variety of people, right? So this could look like taking care of aging relatives. This could look like taking care of a child with special needs, maybe autism or chronic medical conditions. It could also look like taking care of someone with individual health needs. Maybe they have chronic conditions or depression, anxiety. Maybe you're a new mom and you're just adjusting into taking care of a new kid. You're still a caregiver too. So yeah, definitely touching on how critical of a role caregiving is. You're a source of support and companionship for your loved one. And there are so many studies out there that show that caregivers, specifically for people who take care of maybe aging relatives or something like that, they help to improve actually their quality of life and their independence, because one, you're a person that's consistent taking care of them on a day-to-day basis. You're potentially lessening their risk of developing depression because they're being taken care of someone they know and love. And that's why you're doing this, right? Most of the time, I feel like, at least when caregivers are involved in someone's care, it's because you love or care for that person. And that does not negate, though, how difficult of a role this can be. So we're definitely going to touch on a few of those things today. So as we dive in here, we're going to start out with our first question. So what does caregiving look like in your day-to-day life? So we're going to open this up in the chat box. Please utilize that as we're discussing this. But if you're a caregiver, or if you know someone who's a caregiver, what is something that you experience in your day-to-day life? Feel free to put that in the chat as we discuss this. But I know for me in the hospital, there was never a typical day on what I did. It all depended on the person I was taking care of, their medical conditions, and whether that medical condition was predictable or not. Heads up, it usually is not predictable. So it's really hard to say that this is exactly what every day in the life looked like. But on average, we did find some statistics that show caregivers spend nearly 13 days each month doing household to-dos. So like shopping, food prep, housekeeping, laundry, transportation to medical facilities or doctor's appointments, administering medication. All of those things add up to nearly half of the average caregiver schedule. So that is a really big portion, I feel like, of what caregivers do on a day-to-day basis.
100%. And, you know, I think for me personally, the day-to-day, as you said, is not typical. It's very dependent on the person you're caring for, their condition. In my situation, dependent on the child and their situation, how many appointments or specialties they have to go to. And so it's all about scheduling and structure and making sure that I'm fitting in everything that needs to be fit in. And I think it's important to note that even though caregivers, a big part of their day is doing the tasks that Jordan mentioned for the person they're caring for, they also have their own life and their own jobs and their own relationships outside of caretaking. And so it is a lot of how do I juggle and balance all of those things while also being a caretaker. So the day-to-day is never typical.
Yeah, never typical. So one of the second questions we have is, what have you struggled with as a caregiver? So again, in the chat, if you are a caregiver or know someone, please maybe type in a couple words of what you've struggled with as a caregiver. I know for us, we did a lot of research and spoke to a lot of coworkers, friends, colleagues on this subject that they're kind of in the thick of this situation themselves. One of the things that was really surprising to me when talking about caregivers and different strains for them is financial strain. Many people who are caregivers have to leave work early or take PTO or FMLA, leading to lost wages in order to take care of their loved ones. You know, maybe something happens in the moment, they have to rush home and take care of them, and you know, that leads to lost wages. But then on top of that, the average annual out-of-pocket for a caregiver is $7,000. So not only are you reducing your working hours to care for a loved one, potentially decreasing how much you're making, but you're also spending more. So there's a lot of financial strain there. So that was something I actually spoke to a friend about who's in the thick of this right now. And they were like, one, I would encourage anyone who's going through this right now to be transparent with their employer about where they are. If they're a caretaker, what that requires of them. Being educated on what your company's policies are is going to be really vital to that too. And then also checking in on your company's employee assistance program for available assistance, which I know you have a little more experience with that, Andrea.
Yeah, no, for sure. I would echo everything that Jordan said. I know for me, when I came into my role at Apex, I was already a foster parent. So being able to have those conversations off the bat, that this is the role, and what are the company's policies? What availability do they have to make things easy for me, right? And then also with the employee assistance programs and doing more work with a variety of different employee assistance programs, I learned that through those programs, they have a lot of resources for elder care, child care, helping with cleaning services, or even meal delivery services. They can give you lists and resources of those types of things that are within your community or your area that you live, just to make life a little bit easier and take some things off your plate. And that's a free resource that you might have through your employer. So it's important to be aware of that, for sure.
Definitely good. Another strain that I almost feel like is kind of obvious, but I really want to touch on is the emotional strain that can come with being a caretaker. And this role, it challenges the world that you thought you'd be living in right now. Caregiving is not usually expected. Someone gets a diagnosis usually out of nowhere, and that kind of flips your world upside down. So there's a lot of emotional strain that loved ones can experience when someone is going through that. So depression and anxiety, that actually affects nearly a fourth of caregivers who are just spouses. So spouses who are taking care of another spouse. So that statistic, I think, is probably much higher for just the general realm of caregivers. So being mindful that that's a really, common thing to deal with as far as emotional strain goes.
For sure. And I think for me, working in the hospital, I definitely had a lot of empathy for the families I was working with and was able to hear about some of their struggles. But it wasn't until I was doing it on the day-to-day that I really understood the emotional toll it does take. And I think a big thing with that is feeling isolated or feeling like you are the only one who understands what you're going through. And so that's definitely a big strain, and we're going to talk about some ways to combat that here in a little bit.
Yeah, physical strain too. I mean, like I already mentioned, if you're helping with activities of daily living, you're helping someone get up, walk, go to the bathroom, maybe you're feeding them and dressing them. Like, again, it all depends on their condition, right? But nearly 1 in 5 caregivers report, neglecting their needs when they're caring for someone else, and then they end up having fair or poor health, which, that's really difficult. I can speak to that. I would work a 12-hour shift at the hospital, and there were multiple days like I did not eat lunch like I should have, because I'm taking care of someone. I'm invested in making sure they're okay. But then I get to the end of my shift and I'm lightheaded. I'm like, wait a second, I didn't take care of myself at all. So that's really easy to experience.
Yeah, no, I agree. And I always try to remind myself that I have to be healthy, both physically and emotionally, in order to be the best version of myself for the loved one that I'm caring for. But yeah, a lot of that stuff can fall to the wayside because we're so focused on the person we're caring for that we're not getting adequate sleep. We're not eating whole foods or eating at all because we're so busy. So yeah, that's another big strain for sure.
Yeah. So we'll definitely discuss that and different to-dos. But something else that I really wanted to make sure we covered here today is that, there are multiple people who are taking care of loved ones who are dealing with a terminal diagnosis. And I feel like that's just a whole nother beast in itself. There is truly no way to prepare for your loved one getting a terminal diagnosis. I've spoken to friends who have been in the medical field much longer than I have, and they talked about how, this situation, these kind of conversations, they never get easier. I have a friend who went through this recently. Their parent diagnosed with something that was terminal, and they spoke of how difficult it was because they felt like they were grieving something that hadn't happened yet. you know, and that stuck with me quite a bit because I was like, yeah, you're grieving someone that, you know, hasn't passed. And so there are a lot of things you're processing with that. So, you know, acknowledging one, she advised being mindful of respecting your loved one's wishes of how they want to spend their final days, which is really hard, especially if it's different than how you want them to spend that time. So maybe having discussions of like, you know, what can we do together? Are there places you want to go? Are there experiences we want to do together, you know, that we can have while we're facing this situation right now? I think sometimes also a difficult conversation, but that can bring peace of mind in the long run, is that when you have these type of diagnoses, it creates the opportunity to have open conversations with your loved one about what their wishes are, you know, and it helps you to have that peace of mind, you know, maybe when they're not able to advocate for themselves down the road, that, you know, I know this is what they would want. And that can be really helpful during those difficult times, and helping to plan, having a power of attorney, and getting into those specifics. You know, really, really difficult conversations that we definitely don't want to gloss over. But I know also, Andrea, you can speak to like social workers that are available in the hospital, and what they can do to assist with these kind of situations.
Yeah, so in my time in the hospital, I worked alongside a lot of great medical social workers who a big part of their job is to help families who their loved one has been diagnosed with a terminal illness. And they not only help with just support throughout the process and maybe navigating some of those conversations about end of life that you talked about, but they also help with resources, after planning, things like that. So know that those services are available to you, and you can definitely ask for them if you find yourself in that situation.
Absolutely. So Andrea, can you dive into like, okay, I'm a caregiver. How do I even begin to start taking care of myself? Like this seems almost foreign right now.
Yeah, for sure. So I touched on this a little bit previously, but for me, structure is key, right? Not only am I balancing the schedules of the people I'm caring for, their appointments and everything like that, but I'm also balancing my work life, and I'm balancing my outside relationships, and I'm balancing taking care of my physical and emotional health. And so it's important to have a base of structure and routine, but also have some contingency plans, because sometimes appointments are going to get canceled or moved, and you've got to have flexibility. So having structure, but working in flexibility with that, if that makes sense. And along with that structure, something for me is building into that routine, that time for myself, prioritizing me, even if it's just 15 minutes a day, even if it's going on a walk during my lunch break to get outside, which is another tip I have on here. You know, getting outdoors, we are in the sun, we get vitamin D, which is proven to decrease the risk of depression. So really getting out there and doing those types of things for yourself, even if it's, you know, listening to an audiobook on your way home, just little things that you can do to prioritize your time.
Well, and honestly, like there's no limitation on that. Like I said, the friend I mentioned before, she was talking about how like her employer offered a wellness incentive, and so she took salsa lessons. It was something that was active. It was something that kept her mind off of everything that was going on. It was paid for by her employer, and it was just a really cool opportunity. And she was like, this is what brings me joy right now, so that's what I'm going to do and prioritize for myself on a weekly basis.
That's so fun. I love that. That's a great example. And also making sure that we're prioritizing some of those physical aspects, such as sleep, getting rest. And that also goes in with having that flexibility. So maybe it means that you need to sleep when the person you're caring for is sleeping, because that's the only time that you can get those allotted hours, right? And then the big tips I have are utilizing your resources, and network supports, and also leaning into your own personal supports or support groups. So what I mean by that is, you know, there are a lot of churches, organizations, some of which maybe are associated with hospitals or doctors' offices that do provide resources for individuals who are caretakers. And so that might be a meal train, that might be transportation services to help get people to appointments, you know, so really leaning into those supports and utilizing them because they're there to help you. That's why they're there. And then also asking for help personally for yourself. I know for me, like I said, isolation or feeling, very alone in the caretaker role is something I've experienced. And so having support groups, even just Facebook groups of other people that are experiencing what I'm experiencing, has been very helpful. And then I can't leave out, leaning into therapy. That's something that I utilize as a support there in addition to family and friends.
Yeah. And I think we definitely don't, gloss over the fact it can be really, really difficult to ask for help or accept help. I get that. Something that my friend had said, though, was that it took them realizing I am not the only one who loves this person that I'm caring for. And so I need to let other people love them too. And that's not easy. But I think remembering that, I mean, she said that and it almost brought me to tears because I was like, gosh, I wish like more people remembered that. Like, you're not in this alone, and remembering that people love you and want to help you and love your loved one and want to help them as well. You also might be like me though and thinking, okay, maybe I'm not a full-time caregiver myself, but how do I take care of people that I know are caregivers, taking care of aging relatives, kids with special needs, new children, anything like that? What does that look like? And so like I mentioned earlier, nearly half of caretakers' roles right now are, doing the household stuff like shopping, food prep, housekeeping, laundry. So maybe that looks like helping with one of those tasks. I know something that also is helpful is maybe providing them with a bit of a break and giving them that emotional support. So maybe that looks like you planning an hour for them to go to coffee with you. You maybe ask a loved one or their husband or wife to come back home for an hour so you can take them to coffee to process. And be aware in that time, not often are caregivers wanting you to fix something. If they're processing something, they're really just wanting you to listen. They're wanting an outlet and being able to process. So don't be overwhelmed with trying to fix it, just being attentive and there. I think with bringing meals or assisting with household tasks, maybe not making it a question. So potentially being like, hey, I'm going to drop off dinner today. What sounds good to you? Or, hey, I'm going to come by. I'm going to do some household stuff for you this week. What day works for you and what do you want me to do? Because, I can speak to, I'm always the one like, oh, you don't have to. I'm fine. Like, just make it more of, this is happening. I'm going to assist you. What does it look like that's best for you? I know that Andrea already kind of mentioned that mental health support if needed. I know for me, when I was still a full-time nurse in 2020, I had a good friend that was like, I think you might need to process a lot of the things you're seeing and feeling and experiencing. Maybe going to a counselor would be helpful. And it was. So being mindful of like, maybe I just need to have that as a check-in. And then lastly, kind of going back here, make sure that your loved one is managing their health needs. So there are nearly about 2 in 5 caregivers who will report having chronic conditions because they're negating, taking care of themselves while they're taking care of other people. So say they're like, oh, I've had this headache for weeks now, or I'm having this pain, or I haven't been taking care of myself and eating like I should, or maybe going to the gym, helping assist with that and encouraging them. Maybe you need to go to the doctor. Maybe we should go to a workout class together. I don't know, but knowing that person well and helping to advocate for what they need during that season.
Yeah, I think all of what you said is key. I know for me as a caretaker, I'm the same way as you, Jordan, where I'm, I know I'm fine, but having somebody just provide the support without being asked is great. And also, the people that know you the best are going to know how to encourage you when you do need that push to get that help for yourself. So getting into therapy or going to a workout class, like I love everything that you said there.
Yeah, absolutely. Andrea, you want to dive into these resources?
Okay, so as promised, we've got some resources for you guys. These are all links that you'll be able to click on and access. I wanted there to be diversity among the resources that are provided to you guys because as you see in our presentation, Caregivers come in all different forms, and there's so many people that identify as caregivers. So through these resources, you're going to find just some articles and great information, some actual support groups and things like that that are local for a variety of different types of caregivers. So maybe caring for an elderly parent or an elderly person, maybe caring for somebody with a chronic medical condition. I also wanted to make sure to include some resources for autism support for caregivers, because I think that's an area that's often overlooked for those that care for children or adults with autism. And then I did include some resources for any foster parents as well, support groups there. So yeah, definitely check those out.
Yeah, so like I said at the end of this presentation, you will be able to download this presentation and the slides, and you'll be able to access those URLs that are provided. So that is, we are at the end of all the content that we had, but like I said, we definitely wanted to make sure we allowed a couple minutes to answer maybe a couple questions or comments that people may have added. So Kayla, do we have anything right now?
It looks like a couple came in.
Okay.
The first one is, as a caregiver, how do you deal with feelings of frustration that can come up when the person you're caring for doesn't seem to be caring about themselves or doing the things that they should to improve their health or circumstances?
Yeah, so frustration when someone's, you know, the person you're taking care of maybe isn't taking care of themselves. Yeah.
That's a great question. Thank you for that. So, you know, my motto is always that you cannot work harder than the individual that you're trying to help.
Yeah.
And depending on your role within that person's life, you know, for me, with, you know, the kids that are within my home, I do abide by that. Obviously, you have to do the daily getting them to appointments and taking care of their needs. But when it comes to progress with maybe treatments or therapies that they need to work on, or maybe there's a lack of motivation or some hesitation or resistance, you know, it is okay to allow them the space to not be ready to make that change. But you as the caregiver need to take a step back and lean into your support. So I lean into my support groups. I lean into my family and friends to vent about my frustrations, and I don't bring that to the person I'm caring for. So I'm not going to put more emotional effort and energy into it than they are until they're ready, and then I'll meet them where they're at.
Yeah, and remembering, like, you know, with that sympathy component, like they're processing too. So there's a level of that can just be really difficult. Both of you might be processing differently. So meeting them there and allowing them to process that with you. Oftentimes those individuals are going through some depressive states as they're processing. So allow them that space to just process with you.
For sure.
Yeah. Anything else?
The next one is, how do you handle guilt you experience from caregiving? I get FOMO when I have to miss out on invites from my friends because I have to take care of my grandmother and make sure she takes her meds.
So getting FOMO when you're still needing to take care of your loved ones, which FOMO, fear of missing out is what that stands for. So yeah, Andrea, I don't know if you want to maybe start out with this one.
I mean, I think for me, it starts out with, you know, caregiving being the priority, the choice, right?
Yeah.
And so the people that surround me need to understand that and understand that that is going to be my priority.
Yeah.
And it is something that I choose. And so, yes, there are going to be times where maybe I'm sad that I can't go to a spur of the moment Wednesday dinner or outing, right? But that doesn't mean that I can't still prioritize time for me and my friends. It's just gonna be a little bit more structured than maybe it was prior, which means that, you know, I look at my calendar on a month-to-month basis, and maybe it's scheduling 2 times a month time to spend with friends and communicating that ahead of time.
Yeah, well, and being honest with them about what you need to kind of make that time easier. You know, I've had friends who are like, hey, I'm in the middle of this season, I'm taking care of my loved one. Is there any way we can meet kind of closer to my house? Like, can we meet here in this town and people come this way? And that, I mean, if we can alleviate that burden, and if they're good friends, they're going to do that, you know? So just being really open and, you know, being willing to plan a little more ahead and being honest with your friends about where you are. so that they can support you amidst that too, for sure. That's a good question. Good question.
Looks like the last one we have here is, what's the best way to approach asking others for help, such as a situation when you're caring for your parents, but you have brothers and sisters who should also be helping as well?
Yeah, so when family members aren't helping as much, maybe as
Yeah.
you are. Yeah.
That's a really tricky one, but it is very common.
Mhm.
And, I think starting off initially setting good boundaries and ground rules when a loved one is coming into a position where they need to be cared for, where everyone knows their roles and responsibilities. Everyone is able to talk about what they can contribute in the situation at this time.
Yeah, and that might look like, maybe I can't contribute as much time, but like we talked about earlier, there's a financial strain as a caregiver. So maybe they kind of help more monetarily.
Yeah.
And, because you're giving your time, I can offer this. And just figuring out what works best for everyone. Also, if you're that, sibling or kid that's the one that lives closer and is doing a brunt of that work, maybe also scheduling like, hey, is there like a week you guys could come? Maybe just give me a bit of a break so I can kind of recharge and jump back in. And doing that kind of communication earlier is going to be really important. Not waiting till you're burned out, you're frustrated, you're holding grudges, like making sure you're communicating as early as possible with this kind of stuff, for sure.
100%.
Yeah. All good questions. So, well, that's all the time that we have today. Again, if there are any more questions, you guys have our emails there, both for me and Andrea. Feel free to please let us know if you have any questions or concerns. And we will see you next month for our September webinar coming up.
Awesome. Thank you, guys.
Thank you.
Bye.